cosmetic interventions industry is worth a whopping £3.6 billion. But in the quest for perfection, are you researching your procedure the safe way?
When we stand in the mirror and look every day, is we do that, don't we?
And just say what sort of colour really sort of suits her.
Don't go overboard with it because you just end up looking like someone else.
People can go way too far.
It's about investing in your body, in your health.
Adverts can tell you whatever they want to, and if you're foolish enough, you'll believe what you read.
Who's to say that the website or the people behind it are actually genuine?
No, that would scare me.
After about 3 treatments, people really notice a difference.
It's being corrected already, and then I'm going to work on the tip of your nose.
50% of my patients have had surgery already.
If I could change anything, I'd change my nose.
If I change my nose.
Men who have plastic surgery, no way.
To be honest, I'm actually quite happy with myself.
We're about to find out. Welcome to the Safe Guide to Nip and Tuck. Mr. Malucci, I think one of the burning questions that so many consumers ask is, how do you find a good surgeon?
The best way to find a good plastic surgeon is to go to the umbrella organisations. That's the BAPRAS or the BARPS. They've got long names: British Association of Plastic, Reconstructive and Aesthetic Surgeons, or the British Association of Aesthetic Plastic Surgeons. The other thing I would say is talk to your GP. Your GP will often have knowledge of BARPS or BAPRAS surgeons that he has a relationship with.
But does accreditation to one of these organisations necessarily mean that it is a better surgeon?
Well, what accreditation means is that that surgeon has had to jump through a whole load of hoops through a very long period of time in order to attain that qualification. He will have been trained by senior surgeons throughout his training period. He'll have had to undergo examination, and it is a testament to that training period.
And is the internet a reliable source of information?
The internet has transformed patients' ability to access information. Patients come to consultations very informed. It's one of the big differences we notice as physicians. The only problem and caution with the internet is it's very much a one-way dialogue. In other words, you as the patient are absorbing what's given to you, but it's very difficult for you to decipher what's relevant, what's important, and perhaps what isn't.
Prices of cosmetic surgery in the UK seem to be fueling the rise of surgery abroad. What alternatives exist in the UK for a more safer and affordable experience?
Whilst people are chasing a cheaper deal, we all know that in the long term it can be a very expensive mistake. There are alternatives in the United Kingdom. I, for example, was part of a group who set up an organisation called MyBreast. The idea being to try and deliver high-level cosmetic surgery done by the best people, the best institutions, at an affordable price. And even if that price is a little bit more than perhaps some of the tourism prices, remember it's about investing in your body, in your health and in your long-term future. What questions should we be asking a cosmetic surgeon during a consultation? I think you need to ask him about what his area of specialisation is. You should ask to see his work, ask to see before and after pictures. That's very reasonable. And of course the other thing is, go and see a few other surgeons as well. You know, perhaps 1 or 2 others. Not too many, but 1 or 2 others. And also, whoever you go and see, ask them about their complication rates. All surgery carries complications, as we know. Ask your surgeon about it. Have a frank and open discussion. He won't mind.
The internet is a safe place to find a surgeon.
Look on the internet, I'd look at reviews, obviously.
I think that's a bit stupid. You don't know who you're talking to, really, do you? Like, you can see a website, but who's to say that the website or the people behind it are actually genuine?
No, that would scare me.
I'm Dr. David Eccleston, and I'm going to give you my 3 top tips for finding the best cosmetic clinic. First of all, CQC registered. The Care Quality Commission is responsible for inspecting and licensing medical clinics and will be very, very critical about anything that doesn't bring it up to the level of a hospital. So you can be assured of clean, sterile facilities with experts who will look after your every need. Secondly, I would suggest a medically led clinic. We can all see these special offers in these beauty salons where you can have your fillers done for a certain amount, and if you come to a medically led clinic you will pay a little more. But don't shop around on your face, shop around for your new sofa, your new TV and your new car. But a medically led clinic means, God forbid, if anything does go wrong on the rare occasion, you're in the right place for that to be sorted out. And thirdly, personal recommendation. Adverts can tell you whatever they want to, and if you're foolish enough, you'll believe what you read. But believe what your friends say, believe what other people say who've had a good result, because if they've had a good result and they're prepared to talk about it, then that's a clinic worth visiting.
If I was going to have cosmetic surgery, I guess my main thing would be to have a recommendation from a friend or someone else that had used a particular company.
I'd look for a good surgeon in London.
I would ask my friends or people which had already.
Research your provider, select a qualified, reputable practitioner to perform your procedure. Find out how long they have been practicing, what qualifications they have and what procedures they specialise in. Check that they have adequate professional insurance to carry out that procedure. You can speak to organisations such as the British Association of Plastic, Reconstructive and Aesthetic Surgeons for advice. Meet with your practitioner who will be carrying out the procedure before the day of your treatment. Discuss with them the risks and don't be afraid to ask them questions so you know what to expect. Don't be influenced by price or cut price deals. Cheaper isn't always better. Finally, utilise a cooling off period to give you an opportunity to go away and think carefully about whether the procedure is for you. If things don't go to plan and you are unhappy with your procedure, then speak to your provider immediately. Things can and do go wrong even in the best of hands, but a good provider will do their best to put things right for you. If your provider is unwilling to help, then consult with a legal expert who specialises in cosmetic surgery litigation as quickly as possible. Your legal expert will explain what your options are and can direct you to other sources of professional and emotional support.
If plastic surgery goes wrong, then I don't think there's as much help to correct it as there is to do the surgery in the first place.
Don't go overboard with it because you just end up looking like someone else.
People can go way too far with the treatments, they can just end up looking horrendous.
It gives me great pleasure to hand you this award for Sculptra as Clinic of Excellence.
Thank you very much indeed, that's absolutely lovely. We should put this proudly on our shelves, thank you so much.
Congratulations, Dr. Mountford, on this fabulous award. Tell us a bit more, why did you receive it?
I think we received it because we've been using Sculptra for 15 years, myself and my other cosmetic practitioners, and we love it. It's a very soft, natural product, enhances the face beautifully, and we use a lot of it. It's as simple as that.
Well, clearly a popular brand with your patients, but why are cosmetic injections becoming so popular nationwide?
I think they're becoming really popular because we can treat the face globally. Instead of just chasing lines and wrinkles, we can softly contour cheeks, volumise parts of the face we never could before, but in a soft, understated way. And I think the public have really latched onto that and are embracing that.
Talk to us about the areas of the face that Sculptra can help.
We can target the temples here, where there becomes, as we get older, particularly women with fine, fair skin and not much padding here. And that's a lovely place to inject something like Sculptra, which will lift and support and volumise the temples. Similarly, what often happens as we get older is this fat pad disintegrates, degenerates, and we get this slippage in the skin. And what we really all do, don't we, when we stand in the mirror and look every day, is we do that, don't we? Yes. And a lot of us don't want surgery. So actually supporting this malar fat pad will give support and lift to the upper face. Even here, would you believe, just beneath the nose, just this top here, women particularly, and men, but women notice this, the gap between the nostril and the top lip as we get older gets greater. And that's not so attractive. We actually look quite masculinised. So if we actually put a bolus of Sculptra here, it would help support and lift the upper lip. And similarly, again, the classic areas, the marionette lines that we've all tackled for many years as cosmetic doctors. There's a nice wodge of fat that sits across here when we're young, and as we get older, that fat just disintegrates and we get this sort of witchy chin.
How long can we expect the results of Sculptra to last?
The results of Sculptra last about 2 years. I normally top up about once a year just to keep it really fresh. And normally I do a course of treatment that may be anything from 2 to 5 treatments depending on the age of the patient. The older the patient, the slower the response, but it can be equally as good.
Many people don't understand the differences between injectable products. So what is the difference between a temporary, a semi-permanent and a permanent filler?
Okay, semi-permanents are the ones that most of us are injecting all the time because they're deemed safe, they naturally resorb into the skin, and they tend to be the hyaluronic acid fillers. Lift an instant result and they last about 6-9 months. They can be dissolved if a patient doesn't like the result, so that's really reassuring. The permanent fillers are exactly what they say on the tin. They last a very long time, they sit in the skin permanently, and the only problem with that is as the face ages, they can take on a different appearance. They may not look quite as good as they did when they were first put in, and they can't be dissolved. And semi-permanents are the middleman. They last a bit longer, they actually can be used to inject the whole face, and they break down perhaps after about 2 years.
Coming up after the break, we watch a cosmetic surgeon perform a non-surgical rhinoplasty, a beauty editor talk through some top anti-aging treatments, and some advice guaranteed to raise a few eyebrows. The doctor will see you now.